Great Turner sign. He's got internal bleeding.
I'll call surgery.
This episode is set up to be wilder than a mosquito at a blood bank, but mosquitoes only extract fresh blood directly from the animal. You've got magicians setting wallets on fire, Cutner hoping the patient has something wrong with him so he doesn't have to get fired, and all while Amber and Taub attempt to procure a pair of Cuddy's finest gravy catchers without her noticing. Very excited to be reacting to House MD Season 4 Episode 8, You Don't Want to Know. On this channel we are reacting to all 177 House videos, and this will be episode 89. Let's see if I can get the diagnosis before House does as a doctor working in London.
I'm gonna need a volunteer. Ooh. 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 The guy dislocating his shoulder right there. Could you tell the guy next to you to come up?
Come on.
Hi, have we met before? No. There's only one thing you've got to be able to do. Drag a screaming, crying, shackled man out of a tank of water.
Is that part of the act?
I'm new, I think so. Maybe not.
I don't know what's more dangerous here, the magician trying to make his life disappear or Cutner getting hold of a defib. Either way, it seems like he's had a nosebleed and passed out after being turned upside down in water. He wasn't in the water for long, so we have to assume it was more the act of human inversion that triggered this episode, or the stress of being mistaken for a giant goldfish and being left in the tank. So what does being flipped upside down do to our bodies? Well, there's an interesting study that looked at this from back in the 80s, simpler times when ethical approval could be picked up in the corner shop window next to the M&M Crispies and the glow-in-the-dark condoms. Oh, the good old days. The study by Klatz and colleagues took 20 people and hung them upside down to see what happens. They found that increased blood pressure slowed the heart rate and increases pressure in your eyes. Remember, your entire body is made to adapt with gravity going downwards, and that can be a big problem for astronauts as well. You see, when gravity gets weaker, doesn't exist, or points the other way, the heart pumps blood into the brain at higher pressures than needed, causing fluids to accumulate in the brain and increasing the pressure. That can even cause brain swelling and hearing loss, but if it happened in this short of an interval, then every gymnast would be in a wheelchair, which they obviously are not. Maybe he already had high blood pressure or a heart condition that was accentuated by being upside down and led to the nosebleeds. I'd want to know his history, check the nerves coming from his head, listen to his heart, get a trace and some initial blood tests and take it from there.
You screwed up the trick, started drowning, and you got a cardiac arrest.
You're talking about a challenge?
Go run your tests. If you're wrong, you're fired. I need you to bring me the thong of Lisa Cuddy. Not kidding.
No valvular regurgitation, no wall motion abnormalities, no structural defects.
Would it help if I puked? Pick a card.
Our boss thinks your cardiac arrest was just a result of you accidentally drowning.
The boss is an idiot. Put it back.
We're gonna prep you for a transesophageal echo.
Might want to check your wallet first. Oh.
That's my card. How did you do that?
Do it again.
TTE and TEE revealed no.
Send the patient home. You can give him a lift. What about his lungs? Get an MRI.
Ow! 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 My stomach!
Great Turner sign. He's got internal
I'll
bleeding.
call surgery.
This episode is set up to be wilder than a mosquito at a blood bank, but mosquitoes only extract fresh blood directly from the animal. You've got magicians setting wallets on fire, Cutner hoping the patient has something wrong with him so he doesn't have to get fired, and all while Amber and Taub attempt to procure a pair of Cuddy's finest gravy catchers without her noticing. In case that wasn't spicy enough, the reward for this feat is immunity from being fired and to nominate 2 people, of which one will get fired. Surely they just need to focus on getting the magician better though, because if he can get a card in a wallet, then surely he can remove Cuddy's wallet cover without her noticing. But what do we know about him so far? Well, he passed out as soon as he hit the water, had a cardiac arrest, has no history of angina or heart conditions, and the jelly scan of his heart was normal and still normal when they put the probe in his food pipe to take an even closer look at the heart. And now we have a new clue: bruising on the abdomen as soon as he entered the MRI machine, and Cutner said this was Grey Turner sign, and that's when you get bruising of both flanks because of a bleed behind the peritoneum, which is basically a giant wrapper for your abdominal organs. So what could cause this? Well, pancreatitis would be an interesting one because it's also associated with some autoimmune conditions that could account for his heart suddenly going on strike. There are a few candidates including autoimmune pancreatitis, and it starts with L, ends with lupus. You know what I'm talking about. That doesn't quite explain why it happened as soon as he got into the MRI machine though. He must have had some kind of metal inside him. The bruising was on the left side, which could be around where the stomach is. So I've got a theory. What if he swallowed the key to the handcuffs to try and vomit it up and then free himself from the cuffs? Or maybe he was holding it in his mouth and then he was going to take it out, but when he went unconscious, he accidentally swallowed it. Then the team put him in a giant magnet, which caused the key to rip through his stomach. That could work, but still doesn't explain the cardiac arrest. Let's see if I'm right.
Surgeons have transfused 3 units AB positive, but they're still looking for the source of the bleed.
Oh, to Cuddy.
These are not Cuddy's panties. She's wearing a red bra today.
An intestinal infarct could be linked to the cardiac arrest.
You're wearing a black bra. You two cut a deal. You guys ever wonder how he was gonna get out of that water tank?
And his spleen is shredded.
Watch closely. The MRI's magnet ripped this through your intestine into your spleen.
Didn't screw up that trick.
Pick a card.
I don't screw up.
It's Cuddy's.
You take the gloater to the patient's drug den. Biopsy a blood vessel from around the heart, test for polyarteritis nodosa.
He did swallow the key. MI6, if you're looking for a new agent to crack your cases, call me. My autoimmune theory seems to be holding up so far, as Amber suggested polyarteritis nodosa. It's when your body's immune cells become dysfunctional and start attacking your own blood vessels, hence arteritis. It usually causes things like fever, weight loss, fatigue, and joint pain, and can be diagnosed with a biopsy of the presumed affected area, which the team want to do. Before sticking a needle in his heart though, you could do some slightly less invasive tests like a SED rate to see if there is actually a high level of inflammation in his blood. His symptoms don't quite seem to fit with this, so Taub is thinking it could be related to cocaine use. That could work, but for House, that diagnosis would be about as spicy as a korma marinated in the sea. The title for this episode is interesting. Do you really want to know? There also seems to be a focus on his magic. Maybe if we find out how he does his tricks, then we would find out the diagnosis as well. It'd be insane if they managed to structure it like that. Question for you smart people. What is the most dangerous magician trick? Answers down below, and you'll get the answer at the end of the video.
I think you're hiding a medical condition. You've got something going on. I need you to take care of it.
How did Cole get those panties off, Cuddy?
Huh? Tularaemia.
How'd you do the trick?
People come to my show because they want a sense of wonder.
You're not wearing underwear. You seen Dr. Cole? Oh my God! How'd you do it?
Dr. Cole is the leopard of the team, staying undetected and unseen until the opportune moment to strike, and then before you know it, pow! Your gazelle briefs take the top spot in the trophy cabinet. Let's take it back from the savannah for a moment because we have a new clue. Rabbits. You see, rabbits carry a type of disease that Taub mentioned called Tularaemia. This diagnosis can be so deadly that the bacteria is classed as a bioterrorism agent. It causes many different presentations like ulcers on the skin in the ulceroglandular form, painful eyes in the oculoglandular form, sore throat in the oropharyngeal form, but the most dangerous is the typhoidal in the septicemic form. That's when the bacteria makes it into the bloodstream and could cause some serious damage, but he's not presenting like any of those types. Also, a magician has rabbits. Call CNN quick. Interestingly, the fact that the magician had the key in his stomach now explained the bruising, so the symptoms are still nosebleeds, passing out and going upside down, and cardiac arrest. Let's look at this in a different way. When someone's heart stops, we can think of the causes as the 4 H's and 4 T's. The H's are hypothermia, so being cold, hypovolemia, so not enough circulating blood volume, hyper or hypokalemia, which is high or low potassium, and hypoxia, which is low oxygen. The 4 T's are tension pneumothorax, which is air pressure building around the lung, tamponade, which is blood around the heart, thrombosis, which is a clot in the lung, and toxins. When I think about it, except the rabbit, we still really don't have many clues to be able to narrow it down, but generally toxins would work really well here. House was saying that our magician looks like he hasn't slept much. Is he hiding some kind of stimulant pills that he takes to keep him wired? That will be my first diagnostic guess.
If I tell you, then where's the magic? He passed out. Ultrasound revealed bleeding around his heart. We drained 100 cc's before it stopped.
Could be a clotting issue.
If he developed DIC after the surgery, even a normal biopsy bleeds out of control.
Could be cancer.
Go find out where he's hiding his cancer.
Oh, my hands feel kind of numb. This time tomorrow, I'll be dead.
What's that?
It's not a tumor, it's another bleed.
He's bleeding all over the place.
Anyone bother looking at his panel? His immunoglobulin levels are low.
He's seizing.
Rest of you, pull his medical records. Anything associated with amyloidosis.
Did the patient just predict his own death? Sounds like a challenge to House. He will do everything in his power to prove the patient wrong, and also to save his patient's life. Maybe I should take up magic as well, because I did just mention the bleeding around the heart that can cause a cardiac arrest, and now he has it. Although his jelly scans from earlier were normal and they would have shown up if it was significant, so I might not join the guild of traveling magicians just yet. We've got some new clues though: low immunoglobulins and multiple bleeding points. Foreman suggested that it could be amyloidosis, which is an interesting diagnosis where abnormal proteins build up in many body tissues, but what else could it be? Well, immunoglobulins are just a fancy way of saying antibodies, and so when their levels are low, you become very vulnerable to infection. Now we know he also has a problem with bleeding, and that could be because of a platelet issue that he has. You know where immune cells and platelets both are made? The bone marrow. That means the problem is likely coming from there. You see, the bone marrow has to constantly replenish our blood cells with new fresh cells using stem cells. Those are unique types of cells which are not specialized and can keep renewing our blood to keep it healthy. As soon as this marrow becomes damaged from things like chemotherapy, viruses, cancers, or toxins, then we get problems that our patient is facing. Leukemia could cause all the patient's symptoms, including the heart attack and bleeding, and so that has to be my second diagnostic guess.
You had a grand mal seizure. We're giving you liquids and an anticonvulsant. You're not going to put me on the block, are you?
I decided I'm going to make my decision based solely on who deserves to be here.
Just eliminate your competition, which is definitely not me. Flank pain. His kidneys are shutting down.
Nothing in his medical history remotely indicates amyloidosis.
Kidney failure proves I'm right about the bad blood.
Go prove I'm right. Do a subcutaneous fat biopsy.
At least let us eliminate the bad blood theory. Check the blood banks for mismarks and contamination.
I've got money. You need money.
We need more than 2 hours. Some of these cultures will take at least a day to grow.
He'll be dead in a day. Give me the blood. You're not getting it checked, because you already know the answer. Found an old picture in your wallet. Figure it's your mom, except she looks about 32 years old. She's dead.
Huntington's Chorea.
I have to admit, I knew 13's mum had Huntington's, as I have seen a later episode. I didn't realize though that House caught onto it by seeing a photo of her in 13's wallet, then checking her obituary. If you're gonna go to a House interview, make sure your closets are cleaner than a house cat at a grooming competition. What is Huntington's though? Well, it's a progressive neurodegenerative condition that messes with the movement centers in your brain, causing progressive flailing movements. It's autosomal dominant, which means you need to inherit it from one parent, so assuming her dad is okay, the fact her mum has it means that it's 50-50 that she gets it. The cruelest part is you don't know if you have it until you start approaching your 40s. You could have lived the first 30 years of your life without any symptoms and then become so incredibly disabled by it that you need carers. That's why 13 is so haunted by this, because she's starting to get symptoms, which means she could have been on the bad side of a coin flip. While all of this is going on, we still have no idea what's going on with the patient. I usually love House, but this Kuttner bad blood theory is wild. It relies on two things. One, that the blood is contaminated or mislabeled in some way, and two, that the cardiac arrest at the start was just a freak accident and the magician was lacking oxygen. The thing is though, that was exactly what Kuttner was arguing against at the start of the case, which would then mean that if they left him alone instead of pulling the key out of his stomach with a giant MRI machine, which probably wouldn't happen in real life because it doesn't have that power, then our guy would have been back to shuffling decks and raising necks in no time. Now House is so confident that Kuttner's wrong and the patient he thought was fine has amyloidosis that he's putting himself on the line to test this bad blood theory. I'm not gonna lie, this is one of the most interesting House episodes I've seen so far. It deserves a strong rating. We also have a new clue though, kidney failure. I also still have one diagnostic guess left, so what can cause bone marrow and kidney failure all at once? I probably won't use my guess yet, but it's multiple myeloma. It's another type of cancer that can form because of cells called plasma cells becoming overgrown and firing out loads of abnormal proteins. It could in theory cause low immunoglobulins to be detected because instead of releasing the full antibodies, it produces the light chains instead, which are deformed antibody components instead of the full thing. If these build up, then they can clog up the kidneys and cause it to fail. It could also cause nosebleeds and bleeding around the body because of the lack of platelet production. That could work quite well and be very unusual considering his young age, but let's get some more clues.
I'm leaving when this case is over.
No, you're not. What?
You're sweating. You're burning up. You're sick.
I am not sick. Who's spiking?
Got the kidney sample.
It's a little much for a first date.
Obviously, you've never dated me. Now I just need a piece of your liver.
Yeah, you might want to use a little bit of lidocaine.
Oh, yeah, I forgot. Slight pinch.
All your biopsies are clean? Of course, you're type AB. Universal recipient.
Of course, you're type O, universal donor. There's no reason to ask anyone their blood type. You were wrong about everything. It was never magic and you're not dying.
This show is about to reach its climax and I've started to understand why Kuttner's crazy blood theory was put in here even though it didn't quite fit. You see, House had to have the transfusion so him and Wilson could have the conversation leading to the epiphany. That was related to someone's blood type. I think I've cracked it. Even though it isn't the most medically interesting, it fits perfectly. The patient screwed up the trick, caused this cardiac arrest. If word got out that he screwed up, then his reputation would be ruined and he'd forever be the magician that almost killed himself underwater. He then needed to make sure that him being unwell was convincing enough to save his reputation. He knew the key was in his stomach, he also knew his blood type and then intentionally made sure he got the wrong blood so his body would start rejecting it. That's why House just had a mild transfusion reaction because he actually is AB, whereas the patient's real blood type isn't AB, leading to his leg swelling, seizures, kidney failure due to a transfusion reaction. That has to be my third and final diagnostic guess. We are locked in. If I get this, then that would be the icing on the cake for a magical episode.
What's your blood type?
Type A.
His blood's fine. We just gave him the wrong type. Because we don't test blood for type, we test for antibodies. His body's making an extra antibody, type B. Finally had a case of lupus. Flush him with saline, transfuse 4 units type A, and start him on steroids. He'll be back hoodwinking idiots in no time.
I nominate Amber. I nominate Kuttner.
Kuttner's a liability. It's only a matter of time before he burns the hospital down. You made a deal with Cuddy. That's how you got our underwear. Your scheme was brilliant, and you're fired. The whole point of this was to subvert Cuddy. You became her partner, gave her power she didn't already have.
What the hell is this?
Looks like an envelope with the results of the genetic test for Huntington's inside.
I don't want to know. And you know that when you run out of questions, you don't just run out of answers. You run out of hope.
Lupus! Lupus! I actually predicted this episode pretty well. I got the key, I got the lupus, but you know what I didn't do? Put the diagnostic guess to it. I did get the transfusion mismatch with the third guess, but oh man, that doesn't count, surely. Let me know your opinion in the comments. So how on earth did lupus cause a transfusion mismatch? The lupus antibodies interfered with the blood typing test, making the lab think that he was AB when he was just type A. This has actually happened happened in lupus, and a case was published in The Lancet in 2007. 26-year-old woman with lupus presented with a change from type A to type AB because of a false positive result. These blood changes have been described in stem cell transplants and leukemia before, but are exceptionally rare. Really impressive that the writers at Universal knew about this and created such an elaborate story about it. 8.5 out of 10 entertainment, 8 out of 10 accuracy, 9 out of 10 diagnosis. The most dangerous trick is the bullet catch trick, which has killed over 10 magicians. This episode doesn't make full sense until you watch the previous one where a boy just wants to be normal.